Joining us now is Dr. Mario Ramirez. He's an emergency physician and the former pandemic and emerging threats coordinator under President Obama. So, Dr. Ramirez, let's start there with India. That country sent assistance to the U.S. during the early stages of the pandemic. Now, America is returning the favor. Just explain to us, how critical is it to the world to bring the virus under control in India, a country with a 1.3 billion population?
Well, it's really important, Joe, and I think it highlights, the split that we're seeing in the world right now. The news here in the United States is that things are continuing to get better. But I think sometimes here in America, we're not aware that the situation is still worsening considerably around the world. And a lot of people have highlighted the risk that this much disease circulating in other parts of the world creates when we talk about, the potential for variants and some of those other things. But just the scale of human suffering in India right now is just vast and extremely difficult to comprehend. And, I think the U.S. is doing a good thing by supporting India, but it's going to take a long time for us to turn the tide in that country. India has about 940 million sort of adults that are eligible for vaccine, but only the capacity to produce about 70 million doses a month. And so it's going to take a long time for us to turn the tide in that country. And while that's going on, there's significant risk to other countries in the region and certainly to the rest of the world.
Here in the U.S., more than half of the states are now reporting a decline in cases. This is happening as many states are relaxing restrictions and with the CDC just a couple days ago relaxing the mask guidance outdoors. Is that a sign that we are past the worst part of the virus here? How worried should we still be about the variants?
Well, so it should give us increased confidence that we are on the right path, Joe. And all of the indicators, are giving us better confidence that the vaccines are working as they should. The CDC has released data showing that, the vaccines continue to be highly effective out there in the wild, and we're seeing the number of cases and the number of hospitalizations and even the test positivity fraction, coming down. And those are all good signs. But the other number that's coming down that we really need to worry about are, first, like ESA reported, the number of decreasing average vaccinations per day. And we're not quite at that point yet where we have enough of our population vaccinated to feel like we're completely out of the woods. But the other number that's coming down that we really need to, sort of try to reverse is the amount of testing that's going on. As we start to reopen the world, and particularly as we start to reopen workplaces and other things like that, surveillance testing is going to be really critical. And as we start to push people back into their normal lives, we've got to keep a close handle on what's going out there so that we don't miss a potential surge in the future.
So many important points. Dr. Ramirez, as always, thank you so much.
Good to see you, Jeff.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.